Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear an audiologist talking to a patient called Mr. James. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in. Hello. Is it Mr. James?
Yes, that's me. Good morning.
Good morning, Mr. James. I understand that you've been referred here because of concerns about your hearing. Is that correct?
Yes, that's right. I've noticed some difficulties hearing lately, and it's started to impact my daily life.
I see. Could you tell me a bit more about when you first noticed the changes in your hearing? Was it sudden or did it progress gradually over time?
It was gradual. I think it started a few years ago. At first, it was just the occasional trouble understanding conversations, especially in noisy places. But over the past year, it's become harder to follow even quiet conversations at home.
That sounds frustrating. Are there specific situations where you find it especially challenging to hear?
Yes, mainly in group settings or when there's background noise. For example, in restaurants or when watching TV with my family. It's also embarrassing at times because I often need people to repeat themselves.
I can imagine how challenging that must be. Many people find it difficult to acknowledge hearing difficulties because they feel it's something they can manage on their own. Have you tried anything to improve the situation so far?
Well, I tried adjusting the TV volume, and sometimes I use captions. My GP suggested I get my hearing tested, which led me to you.
Thank you for sharing that, Mr. James. Let's talk about what might be happening. Based on your symptoms, it sounds like you may have age-related hearing loss, which is also known as presbycusis. This typically occurs gradually as we age, affecting both ears and often making it harder to hear high-pitched sounds first, like female voices or children's voices.
That makes sense. I do find it harder to hear my wife and granddaughter sometimes.
Exactly. Presbycusis is common, and there are ways to manage it effectively. One option is hearing aids, which can amplify sounds and improve your ability to understand speech in noisy environments.
I've heard about hearing aids, but I'm worried they'll be uncomfortable or too noticeable.
That's a very common concern. However, hearing aid technology has come a long way. Today's devices are smaller, more comfortable, and much more effective than they used to be. We can even program them to suit your specific hearing needs and environments. Many people find they're able to adapt to them fairly quickly.
That's good to know. Is there a specific type of hearing aid that would work best for my situation?
Based on what you've described, you might benefit from a behind-the-ear BTE model. BTE hearing aids are versatile, discreet, and suitable for many levels of hearing loss. We would first perform a thorough hearing assessment to determine your exact hearing levels and needs.
I see. And how often would I need to wear them? Would it be all day?
Generally, it's best to wear them throughout the day, so your brain can get used to processing sounds with the added amplification. Taking them off and on frequently can make it harder to adjust. Most people find that after an initial adjustment period, they don't even notice they're wearing them.
That sounds manageable. How long does the adjustment period usually take?
For most people, it takes about 2 to 4 weeks to adjust fully, but this varies. Initially, you might feel like some sounds are too loud or a bit unnatural, but your brain will quickly adapt. We would schedule follow-up visits to fine-tune the settings to make sure you're comfortable.
All right, and what about maintenance? I've heard they can be high maintenance.
Good question. Modern hearing aids are actually quite easy to maintain. Most require just a daily clean and a battery change or recharge, depending on the model. We'll teach you the cleaning process, and if you ever need help, you can come in for assistance.
That's reassuring. I think I could manage that. But I'm curious, do you think I'll regain any of my natural hearing over...
Hearing aids can improve your hearing experience, but they don't restore natural hearing. They work by amplifying sounds, which can help you better understand speech and ambient sounds. With regular use, however, many people report significant improvements in their ability to engage in conversations and feel connected in social settings.
That's encouraging. Is there anything else I can do to protect my hearing and prevent further loss?
Yes, there are some lifestyle adjustments that may help. First, try to avoid prolonged exposure to loud noises. If you're in a noisy environment, like a concert, wearing ear protection is advisable. We also recommend keeping the volume at safe levels on personal devices and being mindful of sudden loud sounds.
That sounds doable. I'll be more mindful of those situations.
Great. And remember, regular checkups are important. We'll monitor your hearing over time, and if any adjustments are needed for your hearing aids, we can take care of that.
I appreciate that. One last question, if I may.
Of course. Go ahead.
How likely is it that my hearing will worsen significantly in the coming years?
Extract 2. Questions 13 to 24. You hear an endocrinologist talking to a patient called Rachel Turner. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, come on in. It's good to meet you, Rachel, though I know these circumstances aren't ideal.
Thank you. It's nice to meet you too. I hope you can help me make sense of everything. It's been overwhelming since I found out about the lump in my neck.
Absolutely. Let's take a few minutes to go over what's happened so far and talk about any concerns you might have. Your records indicate that you initially went to your GP after noticing a small lump near your throat. Is that right?
Yes, that's right. I noticed it a couple of months ago. It didn't hurt, so I thought maybe it was nothing. But then it seemed to get bigger. I didn't think much of it until my GP suggested an ultrasound.
It's good that you decided to follow up with your doctor. Swellings in the neck can have various causes, so imaging and tests are important steps. The ultrasound results show a nodule on your thyroid gland, which led to the recommendation for a fine needle aspiration biopsy.
Yes, I remember. That procedure wasn't as bad as I thought it would be, but the results, they're hard to process. My GP mentioned something about suspicious cells.
I understand, and that's completely natural. Let's break down what the findings mean. When we see certain cell types in the biopsy, it can indicate that the thyroid nodule may be malignant, meaning there is a chance of cancer. But it's worth noting that the majority of thyroid nodules are benign. However, in cases where cells appear suspicious, further investigation is essential.
So, I might have thyroid cancer?
That is a possibility, yes. Thyroid cancer is a type of cancer affecting the thyroid gland, which is located at the front of your neck. Fortunately, many types of thyroid cancer are treatable, especially when detected early. The most common types are called papillary and follicular thyroid cancers, and both have high survival rates.
I've never really thought much about my thyroid before. I know it has something to do with metabolism?
Yes, you're right. The thyroid gland produces hormones that regulate your body's metabolism, energy levels, and overall functioning. When the thyroid is affected by nodules or growths, it can sometimes impact hormone production, though many people with thyroid cancer do not experience any changes in hormone levels initially.
So, what happens next? Are there other tests you recommend?
Given the biopsy results, I'd recommend a couple more steps to confirm the diagnosis. First, I'll order blood tests to assess your thyroid hormone levels and check for markers like thyroglobulin, which can provide insight into the nodule's nature. Then, we may consider additional imaging, like a CT scan or MRI, to get a clearer picture of the size and spread of the nodule.
Does this mean I need surgery?
If the nodule is found to be malignant, surgery to remove part or all of the thyroid gland is generally the main treatment. Removing the thyroid, or a portion of it, reduces the chance of the cancer spreading. The good news is that thyroid cancer often has excellent treatment options and outcomes, especially with timely intervention.
And if I have my thyroid removed, how would that affect me? Would I need medication?
Yes, after a thyroidectomy, most patients take thyroid hormone replacement therapy. This medication would take over the role of your thyroid hormones, maintaining your body's metabolism and energy balance. It's taken as a pill each day and closely monitored to ensure your levels stay within a healthy range.
Okay, I think I understand. And what about risks? Are there side effects from the surgery?
That's a good question. Thyroid surgery is generally safe, but like any procedure, it comes with some risks, such as infection, bleeding, or changes to the parathyroid glands, which regulate calcium. Another potential risk is damage to the vocal cords, though it's uncommon. If we move forward with surgery, the surgical team will take every precaution to minimize these risks.
It sounds a bit scary, but I know I need to take this seriously.
That's a normal response. It's always a lot to absorb. But the important thing to remember is that we have time to take this one step at a time, and you have support throughout.
Thank you. So, I just continue as normal until these tests are done?
Exactly. There's no need to make immediate changes to your routine. We'll proceed with the blood tests and imaging to get a complete picture of your thyroid health. After that, we'll meet again to review the results and discuss any next steps.
Thank you. I appreciate you explaining everything. It makes me feel a bit better about what's ahead.
You're very welcome. I'll make sure you're well prepared at every stage. Now, I'll set you up for the tests, and we'll keep moving forward as a team.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor's discussion with a nurse. Now read the question.
Okay, we're using the FUS score for this patient today. Let's go through each category. Yesterday, he was rated low on eye response, no movement or tracking. How are his eyes responding now?
No response still, unfortunately.
All right, that's a 0 for eye response. Moving on, what about motor response? Has he shown any purposeful movements or response to pain?
No, he hasn't.
That's another 0, then. And his brainstem reflexes, are we getting any gag or cough reflex with suctioning?
No, there's no reflex.
No reflex, so that's 0 for brainstem reflexes too. And for respiration, is he showing any attempt to breathe independently?
No, he's fully dependent on the ventilator.
So, that's 0 for respiration as well. With this score, his outlook remains critical, with very minimal responsiveness.
Now look at question 26. You hear a doctor briefing a colleague at the end of her shift. Now read the question.
I covered the basics with him today, discussing options if his condition progresses. He seems open to more support, so I've arranged for palliative care to join us tomorrow for further discussion.
Got it.
I also explained that he can think about appointing a healthcare proxy to help with decisions in the future. I encouraged him to bring his family in tomorrow for that discussion. He's stable now, but it's best if you ensure he has the serious illness conversation materials in his folder tonight, so he can review them before we meet again.
Understood.
Now look at question 27. You hear an intern asking a senior doctor about the diagnosis of a patient. Now, read the question.
Dr. Harris, I have a question about the patient experiencing recurring dizziness. Shouldn't we be considering an inner ear disorder like vertigo as a possible diagnosis?
Yes, that's certainly a possibility, but there are other factors you should look closely at to help narrow down the cause. For instance, while dizziness can often be related to inner ear issues, it's important to consider if there could be other underlying conditions, such as cardiovascular issues, or even neurological disorders. Have you noticed any symptoms that might suggest one of these other causes?
Oh, I see. Like irregular heartbeat or any signs of nerve damage. Thanks for reminding me to examine the broader picture when looking at dizziness.
Now look at question 28. You hear a patient discussing dietary strategies with a dietitian. Now read the question. Lisa, I wanted to ask if managing IBS symptoms is always this challenging. I mean, I've noticed that whenever I eat certain foods, I end up feeling really uncomfortable, even if I thought they were safe.
It can be difficult, especially because IBS triggers vary from person to person. Some people are more sensitive to specific foods or certain combinations, which can make it hard to avoid symptoms entirely.
How do you handle situations like this? I mean, how do you balance avoiding triggers while ensuring I'm still getting the nutrients I need?
You have to remember that managing your symptoms is your primary goal, but it's equally important to maintain a balanced diet. You're accountable for finding what works best for your body, which might involve keeping a food journal or trying out different meal plans. There might not be an ideal solution, but there are several approaches to consider, such as
Now look at question 29. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question.
One of our key priorities is supporting patients in making healthy lifestyle changes, and we recently introduced a program specifically aimed at helping patients who want to quit smoking. The initiative, called Breathe Free, provides each patient with a counseling session where they can discuss any challenges they're facing in trying to quit. We also give them a resource kit with information about nicotine replacement options, relaxation techniques, and contact details for support groups. Patients are encouraged to talk about their progress with their families during visiting hours or even over the phone, which helps keep them motivated. The counselors then check in regularly to provide encouragement and advice based on what each patient needs. We've been really pleased with the response. Patients used to say they struggled to quit because they didn't have enough support or information, and this initiative gives them a better chance to succeed. It's been so effective that we're planning to make it available hospital-wide.
Now look at question 30. You hear an emergency paramedic talking to an accident and emergency doctor about an elderly patient involved in a motorcycle accident. Now read the question.
He
He's 68 years old and lost control of his motorcycle while braking suddenly. His chest hit the handlebars quite hard when he fell.
Right, that sounds concerning. How's his overall condition?
When we arrived, he was alert with a GCS of 15 and he complained of severe pain in his chest. He has no signs of head injury, but the main concern is a suspected chest injury with possible rib fractures. We've immobilized his chest and given him oxygen to help with breathing.
Has his breathing improved since then?
He's breathing steadily, but is still in significant pain. We've administered 100 milligrams of fentanyl and a total of 5 milligrams of morphine to keep him stable for transport.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an orthopedic surgeon giving a detailed presentation on latest innovations in 3D printing technology for orthopedics. You now have 90 seconds to read questions.
Hello everyone. I'm Dr. Moore, an orthopedic surgeon and researcher at Stanford University Medical Center. It's a pleasure to be here today to discuss the latest innovations in 3D printing technology for orthopedics, specifically in creating customized prosthetics. This research represents an exciting advancement that I believe will truly reshape patient care and recovery outcomes for those who require prosthetic limbs. Just to give you some context, prosthetics have traditionally been made with pre-sized components, which means they often require adjustments or even replacements over time as the patient's body changes. For example, a prosthetic leg that fits perfectly today might not be as comfortable 6 months later. This lack of personalization can lead to discomfort, limited functionality, and in some cases, extended rehabilitation. However, with 3D printing, we're able to create prosthetics tailored specifically to each patient's unique anatomy. This approach is transforming how we think about prosthetics because it allows for better comfort, increased mobility, and a quicker recovery process. The way we use 3D printing to design these prosthetics starts with a detailed scan of the patient's limb. These scans allow us to capture the exact measurements and contours, ensuring a precise fit. Based on the scan, a digital model of the prosthetic is created. This model can then be modified to accommodate specific needs, such as extra cushioning in areas where the patient might have scar tissue or sensitive skin. After the model is finalized, we send it to a 3D printer, which constructs the prosthetic layer by layer using strong yet lightweight materials. The end product is a prosthetic that fits like a glove, providing a personalized experience that simply wasn't possible with traditional methods. One of the most remarkable aspects of 3D printing technology is that it allows for rapid prototyping. We can quickly make adjustments and produce new prosthetics as needed. For growing children who need frequent size changes, this is incredibly beneficial, as it allows us to create new prosthetics in a fraction of the time compared to conventional methods. This technology also enables us to quickly test new designs, allowing for continuous improvement and refinement of each prosthetic. A major challenge in the field of prosthetics is balancing strength and weight. Traditional prosthetics can be quite heavy, making them cumbersome and difficult to use. With 3D printing, we can use advanced materials like titanium and specialized polymers, which are lightweight yet extremely durable. This means patients can be more mobile and experience less strain on their bodies. Additionally, the personalized design process allows us to distribute weight more evenly, which helps prevent injuries and improves comfort during extended use. Privacy and data security are paramount in this process. Each prosthetic design begins with a scan of the patient's body, so protecting this information is a key concern. We use secure data handling methods to ensure that these scans and patient information remain confidential. Patients have been very supportive of this technology, but it was important to assure them that their data would be handled safely and responsibly. Some people may wonder if 3D printing means that machines will take over the role of medical professionals in designing prosthetics. The answer is no. While 3D printing is a powerful tool, it still requires the expertise of skilled orthopedic specialists to interpret scans, design the models, and oversee the entire process. The technology supports our work by enabling us to be more precise and efficient. This ultimately means that we can focus on more complex cases and provide more personalized care to each patient. While our research is focused on patients here in the United States, we're also exploring opportunities to collaborate with international partners. By working together with medical institutions around the world, we can refine and improve 3D printing techniques, ensuring that patients globally benefit from this technology. This collaboration is especially valuable in countries with limited access to traditional prosthetics, as 3D printing could offer an affordable, accessible alternative. Thank you all for your attention. I'd like to extend my gratitude to my research team and to the organizations that supported our work. I'm excited to see how 3D printing will continue to evolve and make a meaningful difference in the lives of our patients. Now, I'd be happy to take any questions you may have.
Extract 2. Questions 37 to 42. You hear a conversation between a director and travel medicine specialist. Now, read the questions. You now have 90 seconds to read questions. Good afternoon. It's nice to meet you. I understand you're planning a trip?
Yes, I am. I'll be heading to Southeast Asia next month for about 6 weeks. I'll be visiting several countries, and I'm hoping to spend a lot of time outdoors, maybe even some hiking in the forests and mountains.
That sounds amazing. Southeast Asia is a fantastic region, but it's important to take a few health precautions before you go. Vaccinations and travel health advice will help you make the most of your time there.
I've heard that certain vaccines are required for some countries. I'm honestly not sure what I might need.
It's good you brought this up. Different countries have different vaccination requirements. First, you'll need to be up to date on the routine vaccines like MMR, tetanus and flu, as some places have higher incidences of these diseases.
I've had most of those, but it's been a while. I think my last tetanus shot was over 10 years ago.
We'll make sure you're covered. For travel to Southeast Asia, in particular, we need to consider vaccines for hepatitis A and typhoid, as these diseases are common in areas with lower sanitation levels. You'll likely encounter them through contaminated food or water, especially if you're trying local foods, which I highly recommend.
I definitely want to try as much local food as I can. Are there any other specific health risks I should know about?
Yes, if you'll be spending time in rural or forested areas, I'd also recommend a Japanese encephalitis vaccine. It's not common among travelers who stick to urban areas, but because you plan to hike and be outdoors, it's a good idea. The disease is transmitted by mosquitoes, especially in areas near rice paddies or water bodies where mosquitoes thrive.
Wow, I didn't even think of that. So, Japanese encephalitis is a big risk?
It can be, especially for those spending extended time outdoors in rural areas. The vaccine can reduce that risk. And speaking of mosquitoes, we should also discuss malaria, which is present in parts of Southeast Asia. There's no vaccine for malaria, but there are medications you can take to prevent it. Since it's hard to predict exactly where malaria is found, many travelers take anti-malarial medication as a preventive measure, especially if they're going to rural places.
Do I have to take the malaria medication every day?
It depends on the medication prescribed. Some need to be taken daily, and others just weekly. We can discuss which option might work best based on your travel schedule and any potential side effects. It's also smart to pack mosquito repellent and wear long sleeves and pants, especially in the evenings when mosquitoes are more active.
I'll make sure to pack plenty of repellent. Are there other general tips to help me stay healthy on the trip?
Absolutely. One common issue travelers face is foodborne illnesses, which can often cause stomach upsets. Stick to bottled water and be cautious with street food, especially if it doesn't seem freshly prepared. I also suggest you carry oral rehydration salts and antidiarrheal medications as a precaution. And of course, wash your hands often, or use hand sanitizer to reduce your risk of getting sick.
I'll keep that in mind. Are there any other vaccinations I should consider?
Since you're traveling internationally, some countries may check for proof of a yellow fever vaccine, if you're coming from a region where it's common. Also, rabies can be a risk in some parts of Southeast Asia, especially if you plan to be around animals or in rural areas. It's usually not required, but it's something to consider based on your planned activities.
I hadn't thought about rabies. Is it worth getting vaccinated?
If you'll be in close contact with animals, it can provide peace of mind. Southeast Asia has a significant population of stray dogs, monkeys, and other animals that could carry the disease. If bitten or scratched, you'd need a series of shots immediately after to prevent the disease from developing.
Thanks for all the information. I feel much more prepared now.
Glad to hear that. Once you're vaccinated and have any necessary medications, you'll be well on your way to a safe, healthy trip. Just remember to enjoy yourself and take precautions when needed.
That is the end of Part C. You now have 2 minutes to check your answers.